Question 1. A patient presents a new prescription for Oxycodone 5/325 mg tablets. Which of the following is the appropriate dispensing limit for this medication in Canada under federal regulations for Schedule I narcotics, without specific authorization? A 30-day supply. B, a 90-day supply. C, a 100-day supply. D, there is no federal dispensing limit for Schedule I narcotics. It is often determined by provincial regulations or prescriber instructions. Answer: D, there is no federal dispensing limit for Schedule I narcotics. It is often determined by provincial regulations or prescriber instructions. This question tests knowledge of federal drug scheduling and dispensing regulations in Canada, specifically for narcotics. The keyword federal dispensing limit for Schedule I narcotics is crucial. While provinces may have their own guidelines or best practice recommendations, federally, there isn't a hard limit on the quantity of Schedule I narcotics that can be dispensed per prescription if legally written. Therefore, the quantity is often dictated by the prescriber's instructions and influenced by provincial policies, professional judgment, and clinical need. For instance, a physician might prescribe a 7-day supply for acute pain, or a longer supply for chronic pain management, which a pharmacist would then assess for appropriateness. It's important to remember that while there's no federal maximum quantity, pharmacists must still exercise professional judgment and adhere to provincial laws and professional guidelines regarding appropriate dispensing. Question 2. A patient taking Ramipril presents with a persistent, dry cough. Which of the following is the most likely cause of this adverse effect? A, fluid overload. B, bronchospasm. C, bradykinin accumulation. D, histamine release. Answer: C, bradykinin accumulation. This question focuses on the specific mechanism of an adverse drug reaction commonly associated with a widely used medication. The keywords Ramipril and persistent, dry cough directly point to a classic side effect of angiotensin-converting enzyme, ACE, inhibitors. ACE inhibitors, like Ramipril, prevent the breakdown of bradykinin, a substance that can accumulate in the lungs and lead to a dry, irritating cough in about 10 to 20% of patients. For example, if a patient develops this cough after starting Ramipril, switching to an angiotensin receptor blocker, ARB, like valsartan is often a suitable alternative, as ARBs do not inhibit bradykinin breakdown. Remember that a persistent dry cough is a hallmark side effect of ACE inhibitors due to bradykinin accumulation. Question 3. A patient weighs 150 pounds and is prescribed a medication at a dose of 5 mg per kilogram per day, divided into 3 equal doses. How many milligrams should the patient receive per dose? Round to the nearest whole number. A, 114 milligrams. B, 227 milligrams. C, 341 milligrams. D, 682 milligrams. Answer: A, 114 milligrams. This question requires a multi-step dose calculation, converting patient weight and then dividing the total daily dose. First, convert the patient's weight from pounds to kilograms. 150 pounds/2.2 pounds per kilogram equals 68.18 kilograms. Next, calculate the total daily dose, 68.18 kilograms * 5 milligrams per kilogram per day equals 340.9 milligrams per day. Finally, divide the total daily dose by the number of doses per day, 340.9 milligrams per day / 3 doses / day equals 113.63 milligrams per dose. Rounding to the nearest whole number, the patient should receive 114 milligrams per dose. Always break down complex calculations into smaller, manageable steps, and double-check unit conversions to avoid errors. Question 4. Which of the following strategies is most effective in preventing look-alike, sound-alike, LASA, medication errors in a pharmacy setting. A. Storing LASA medications in separate locations or using tall man lettering. B. Routinely checking patient allergies before dispensing. C. Dispensing all medications in their original manufacturer packaging. D. Educating patients about the potential for LASA errors. Answer: A. Storing LASA medications in separate locations or using tall man lettering. This question focuses on a crucial aspect of patient safety and quality assurance in pharmacy practice, specifically preventing medication errors related to similar drug names. The keywords look alike, sound alike, LASA, medication errors highlight the problem. Physically separating these medications on shelves or using tall man lettering, e.g., dopamine versus dobutamine, on labels and computer systems are highly effective strategies because they visually and verbally distinguish drugs that might otherwise be confused during prescribing, dispensing, or administration. While checking allergies or patient education are important, they don't directly prevent the initial confusion of LASA drug names by pharmacy staff. Implementing clear visual cues at the point of storage and selection directly minimizes the risk of picking the wrong medication. Question 5. A patient on warfarin is starting amiodarone for a new arrhythmia. What is the most important adjustment the pharmacist should anticipate for the warfarin therapy? A. Increase warfarin dose due to decreased metabolism. B. Decrease warfarin dose due to increased metabolism. C. Increase warfarin dose due to increased absorption. D. Decrease warfarin dose due to decreased metabolism. Answer: D. Decrease warfarin dose due to decreased metabolism. This question assesses knowledge of significant drug interactions, particularly with high-risk medications. The keywords warfarin and amiodarone immediately signal a well-known, clinically important interaction. Amiodarone is a potent inhibitor of CYP2C9, the primary enzyme responsible for metabolizing warfarin. When amiodarone is started, it slows down warfarin's breakdown, leading to an increased concentration of warfarin in the body and thus an elevated risk of bleeding. For example, a patient starting amiodarone typically requires a 25 to 50% reduction in their weekly warfarin dose, along with close monitoring of their international normalized ratio, INR. Always anticipate that amiodarone will significantly potentiate the effect of warfarin, necessitating a dose reduction to maintain patient safety. Question 6. According to federal Canadian legislation, which of the following best describes the storage requirements for Schedule I narcotics in a pharmacy? A. They must be stored in a separate, locked room accessible only by a pharmacist. B. They must be stored in a designated area, but not necessarily locked, if under constant supervision. C. They must be stored in a safe or vault that is resistant to forced entry, or in a specific area of the dispensary if a pharmacist is on duty and the pharmacy is secured when closed. D. They can be stored with other prescription medications, provided the pharmacy has a robust inventory system. Answer: C. They must be stored in a safe or vault that is resistant to forced entry, or in a specific area of the dispensary if a pharmacist is on duty and the pharmacy is secured when closed. This question examines critical legal requirements for controlled substances, focusing on secure storage. The keywords federal Canadian legislation and Schedule I narcotics are key indicators. Federal regulations require that narcotics be kept in a safe or vault that is resistant to forced entry, or, alternatively, in a part of the dispensary if a pharmacist is on duty and the dispensary is locked and secured when no pharmacist is present. This ensures their security against theft and diversion. For example, many pharmacies keep their main stock of narcotics in a secure safe, while a working supply might be kept in a locked drawer or a designated secure area within the dispensary during operational hours. It's crucial to understand these stringent security measures to prevent diversion and ensure public safety. Question 7. Metformin primarily lowers blood glucose by which of the following mechanisms? A. Increasing insulin secretion from the pancreas. B. Delaying glucose absorption from the gastrointestinal tract. C. Increasing insulin sensitivity and decreasing hepatic glucose production. D. Inhibiting glucose reabsorption in the kidneys. Answer: C. Increasing insulin sensitivity and decreasing hepatic glucose production. This question tests understanding of the core mechanism of action for a foundational anti-diabetic medication. The keyword metformin points directly to a biguanide, which works differently from other diabetes drugs. Metformin's primary actions are to increase insulin sensitivity in peripheral tissues, like muscle, and to decrease glucose production by the liver, hepatic gluconeogenesis, thereby lowering blood sugar without directly stimulating insulin release. For instance, this mechanism is why metformin typically does not cause hypoglycemia when used alone. Remember, metformin is a workhorse for type 2 diabetes because it improves how the body uses insulin and reduces the liver's glucose output. Question 8. A pharmacist needs to prepare 200 milliliters of a 2.5% with V solution of a drug. How many grams of the drug are needed? A. 0.5 g. B. 2.5 g. C. 5 g. D. 50 g. Answer: C. 5 g. This question requires a basic concentration calculation, which is fundamental in pharmacy practice. The keywords are 200 milliliters and 2.5% with V solution. A 2.5% with V solution means there are 2.5 grams of drug in every 100 milliliters of solution. To find the amount needed for 200 milliliters, you can set up a proportion: 2.5 g/100 milliliters equals xg/200 milliliters. Solving for x, you get x equals 2.5 g * 200 milliliters /100 milliliters equals 5 g. For example, if you needed 500 milliliters of the same solution, you would need 12.5 grams of drug. Always remember that percent weight in volume, percent with V, is defined as grams per 100 milliliters. Question 9. A patient is prescribed ciprofloxacin. Which of the following is the most important counseling point regarding its administration to minimize adverse effects? A. Take with a large meal to prevent stomach upset. B. Avoid direct sunlight and use sunscreen. C. Take with dairy products to enhance absorption. D. It is safe to stop the medication once symptoms improve. Answer: B. Avoid direct sunlight and use sunscreen. This question focuses on critical patient counseling points, particularly adverse effects of a common antibiotic. The keyword ciprofloxacin should immediately bring to mind its class, fluoroquinolone, and associated significant side effects. Ciprofloxacin is well known for causing photosensitivity, making patients much more susceptible to sunburn or skin reactions when exposed to sunlight or UV light. Therefore, advising patients to avoid direct sun exposure and use protective measures like sunscreen and clothing is crucial. For example, failing to heed this advice could result in severe sunburn even after minimal sun exposure. Always emphasize sun protection when counseling patients on fluoroquinolones. Question 10. Which of the following drug classes is primarily used to treat benign prostatic hyperplasia, BPH, by relaxing the smooth muscle in the prostate and bladder neck? A. 5-alpha reductase inhibitors. B. Alpha-1 adrenergic antagonists. C. Phosphodiesterase 5 inhibitors. D. Anticholinergics. Answer: B. Alpha-1 adrenergic antagonists. This question tests knowledge of pharmacotherapy for a common condition and the specific drug classes involved. The keywords benign prostatic hyperplasia, BPH, and relaxing the smooth muscle in the prostate and bladder neck directly describe the mechanism of action for alpha-1 adrenergic antagonists. Medications like tamsulosin, Flomax, or prazosin, Minipress, work by blocking alpha-1 receptors, leading to relaxation of the smooth muscle and improved urine flow. For example, while 5-alpha reductase inhibitors also treat BPH by shrinking the prostate, they do so by a different mechanism, reducing prostate size over time, not by immediate smooth muscle relaxation. Remember, alpha-1 blockers provide rapid symptomatic relief for BPH by relaxing the muscles obstructing urine flow. Question 11. When preparing a non-aqueous topical cream in the pharmacy, what is the typical beyond-use date, BUD, if no specific stability data is available? A. 7 days. B. 14 days. C. 30 days. D. 6 months. Answer: D. 6 months. This question relates to compounding principles, specifically assigning appropriate beyond-use dates, BUDs, for compounded preparations. The keywords non-aqueous topical cream and no specific stability data are critical. According to general compounding guidelines, like USP less than 795, for non-aqueous formulations, the BUD should not be later than the expiration date of any active pharmaceutical ingredient, API, or 6 months, whichever is earlier. For example, if you compound a topical cream using Vaseline and an API that expires in 3 months, your BUD would be 3 months. Always ensure your BUD reflects the shortest expiry of the ingredients or the general guideline, emphasizing patient safety. Question 12. A pharmacist receives a prescription for a medication that they believe is therapeutically inappropriate for the patient based on their health record. What is the pharmacist's ethical and professional obligation? A. Dispense the medication as prescribed, as the prescriber holds ultimate responsibility. B. Refuse to dispense the medication without further action. C. Contact the prescriber to discuss the concern and seek clarification or modification. D. Dispense the medication but document the concern in the patient's profile. Answer: C. Contact the prescriber to discuss the concern and seek clarification or modification. This question addresses a fundamental aspect of a pharmacist's professional and ethical responsibilities. The keywords therapeutically inappropriate and pharmacist's ethical and professional obligation highlight the duty to ensure safe and effective medication use. A pharmacist has a professional obligation to intervene when they identify potential harm or inappropriateness. Simply refusing to dispense or documenting the concern without action does not fulfill this duty. For example, if a patient with severe kidney impairment is prescribed a drug primarily cleared renally at a standard dose, the pharmacist should contact the prescriber to suggest a dose adjustment or an alternative medication. Always remember that advocating for the patient's best interest, even if it means challenging a prescription, is a core professional responsibility. Question 13. Which of the following is the generic name for the brand name medication Lipitor? A. Rosuvastatin. B. Simvastatin. C. Atorvastatin. D. Pravastatin. Answer: C. Atorvastatin. This question tests recognition of common brand generic drug names, a critical skill for everyday pharmacy practice and medication safety. The keyword Lipitor is one of the most widely prescribed brand name drugs. Lipitor is the brand name for atorvastatin, a medication belonging to the statin class, used to lower cholesterol. For example, knowing this helps prevent medication errors when a prescription might only list the brand name or if a patient asks about a generic alternative. Being familiar with the generic and brand names of top medications is essential for efficient and safe practice. Question 14. A patient with a history of severe sulfa allergy is prescribed a medication for a urinary tract infection, UTI. Which of the following medications should be avoided in this patient? A. Nitrofurantoin. B. Cephalexin. C. Trimethoprim/sulfamethoxazole. D. Phosphomycin. Answer: C. Trimethoprim/sulfamethoxazole. This question assesses knowledge of drug allergies and contraindications, a critical aspect of patient safety. The keywords severe sulfa allergy and avoided are crucial. Trimethoprim/sulfamethoxazole, Bactrim, Septra, is a combination antibiotic that contains sulfamethoxazole, a sulfonamide antibiotic. Administering this medication to a patient with a known sulfa allergy could result in a severe allergic reaction, such as a rash, hives, or even anaphylaxis. For example, a patient with a severe sulfa allergy should be prescribed an alternative antibiotic like nitrofurantoin or phosphomycin for a UTI. Always cross-reference patient allergies with prescribed medications to prevent potentially life-threatening reactions. Question 15. A hospital patient is receiving an intravenous 4 infusion of 1,000 milliliters of 0.9% normal saline over 8 hours. What is the infusion rate in ml/hour? A. 80 milliliters per hour. B. 100 milliliters per hour. C. 125 milliliters per hour. D. 150 milliliters per hour. Answer: C. 125 milliliters per hour. This question requires a straightforward calculation of an intravenous infusion rate, a common task in hospital and clinical pharmacy. The keywords 1,000 milliliters and over 8 hours provide all the necessary information. To find the infusion rate in ml/hour, simply divide the total volume by the total time. 1,000 milliliters/8 hours equals 125 milliliters per hour. For example, if the same volume needed to be infused over 5 hours, the rate would be 200 milliliters per hour. Infusion rate calculations are essential for ensuring accurate medication delivery to patients, so practicing these basic calculations is vital. Question 16. A patient experiences a severe skin rash and difficulty breathing shortly after starting a new antibiotic. Which of the following actions should the pharmacist take first? A. Document the reaction in the patient's profile. B. Advise the patient to discontinue the antibiotic immediately and seek medical attention. C. Report the adverse drug reaction to the appropriate national agency, e.g., Health Canada's MedEffect program. D. Review the patient's entire medication history for potential drug interactions. Answer: B. Advise the patient to discontinue the antibiotic immediately and seek medical attention. This question prioritizes patient safety and immediate action in response to a serious adverse drug reaction, ADR. The keywords severe skin rash and difficulty breathing indicate an acute, potentially life-threatening allergic reaction. The pharmacist's first priority is always the patient's immediate safety. Advising the patient to stop the medication and seek urgent medical attention, e.g., go to the emergency room, is critical to manage the acute reaction. While documenting and reporting the ADR are also important, they come after ensuring the patient's immediate well-being. For example, if a patient calls with symptoms of anaphylaxis, the immediate advice would be to use an EpiPen if available and call emergency services, followed by stopping the medication. Patient safety is paramount. Question 17. Which of the following statements about insulin storage is correct? A. All types of insulin must be stored in the refrigerator before first use and after opening. B. Opened insulin vials or pens can be stored at room temperature for up to 28 days. C. Insulin should never be exposed to light, even when unopened. D. Insulin can be frozen to extend its shelf life. Answer: B. Opened insulin vials or pens can be stored at room temperature for up to 28 days. This question tests practical knowledge of medication storage, specifically for insulin, which is crucial for patient counseling and medication efficacy. The keyword insulin storage is central. While unopened insulin should always be refrigerated, once an insulin vial or pen is opened or punctured, it can typically be stored at room temperature, below 30 degrees Celsius, for up to 28 days, though specific brands may vary slightly, before it should be discarded. Freezing or exposing insulin to extreme temperatures, hot or cold, can damage the protein structure and reduce its effectiveness. For instance, a patient might keep their active insulin pen at room temperature for convenience, but unused pens should remain refrigerated. Always counsel patients to check the specific product storage instructions and discard opened insulin after the recommended period. Question 18. According to typical Canadian provincial pharmacy regulations, which of the following elements must be present on a valid prescription for a Schedule I drug? A. Patient's email address. B. Prescriber's phone number. C. Patient's weight. D. Patient's occupation. Answer: B. Prescriber's phone number. This question tests knowledge of essential legal requirements for a valid prescription, a core aspect of pharmacy law. The keyword valid prescription and Schedule I drug emphasize the importance of accuracy and completeness. While specific requirements can vary slightly by province, a prescriber's phone number is almost universally required to allow the pharmacist to contact the prescriber for clarification, verification, or consultation, especially for Schedule I drugs where safety and appropriate use are critical. Other information like patient's email, weight, or occupation might be helpful but are typically not mandatory components for a legally valid prescription itself. Always ensure all mandatory elements are present before dispensing to uphold legal and safety standards. Question 19. A patient is prescribed a new medication and the pharmacist advises regular monitoring of their potassium levels. Which of the following medications is most likely being initiated? A. Amlodipine. B. Hydrochlorothiazide. C. Lisinopril. D. Metoprolol. Answer: C. Lisinopril. This question assesses knowledge of common medication side effects and associated monitoring parameters. The keyword potassium levels and regular monitoring are strong clues. Lisinopril is an angiotensin-converting enzyme, ACE, inhibitor, a class of drugs known to cause hyperkalemia, elevated potassium levels, as a side effect, especially in patients with renal impairment or those also taking potassium-sparing diuretics. Therefore, potassium monitoring is essential. For example, hydrochlorothiazide, a thiazide diuretic, typically causes hypokalemia, low potassium, while amlodipine, a calcium channel blocker, and metoprolol, a beta blocker, generally do not significantly affect potassium levels. Always counsel patients on medications like ACE inhibitors about the importance of monitoring electrolytes like potassium. Question 20. A pharmacist has a 50% with V stock solution of a medication and needs to prepare 100 milliliters of a 5% with V solution. How much of the 50% stock solution is required? A. 5 milliliters. B. 10 milliliters. C. 20 milliliters. D. 50 milliliters. Answer: B. 10 milliliters. This question involves a dilution calculation, a fundamental skill for compounding in pharmacy. The keywords 50% with V stock solution, 100 milliliters of a 5% with V solution, and how much indicate a dilution problem that can be solved using the C1V1 equals C2V2 formula. Here, C1 equals 50% stock concentration, V1 equals unknown volume of stock solution, C2 equals 5% desired concentration, and V2 equals 100 milliliters desired final volume. So, 50% asterisk V1 equals 5% asterisk 100 milliliters. Solving for V1, V1 equals 5% asterisk 100 milliliters slash 50% equals 500 slash 50 is equal to 10 ml. This means you need 10 milliliters of the 50% stock solution, which would then be diluted to a final volume of 100 milliliters. The C1V1 equals C2V2 formula is incredibly useful for these types of dilution calculations. Question 21. A patient is picking up a new prescription for metronidazole. Which of the following counseling points is most crucial for them to understand to avoid a severe reaction? A. Take this medication on an empty stomach. B. Avoid all alcohol during and for at least 3 days after treatment. C. This medication may cause orange discoloration of urine. D. It is essential to take this medication with a full glass of water. Answer: B. Avoid all alcohol during and for at least 3 days after treatment. This question highlights a critical counseling point for a specific antibiotic to prevent a dangerous drug-alcohol interaction. The keyword metronidazole should immediately trigger recall of its infamous disulfiram-like reaction with alcohol. If a patient consumes alcohol while taking metronidazole, they can experience severe nausea, vomiting, flushing, abdominal cramps, and headaches. Therefore, counseling them to completely avoid alcohol during therapy and for at least 72 hours after the last dose is paramount. For example, even mouthwash or cough syrup containing alcohol could trigger this reaction. Always emphasize the absolute necessity of alcohol avoidance with metronidazole to ensure patient safety. Question 22. Which adverse effect is characteristic of loop diuretics, such as furosemide, but generally not seen with thiazide diuretics, such as hydrochlorothiazide? A. Hyperglycemia. B. Ototoxicity. C. Hyperuricemia. D. Hypokalemia. Answer: B. Ototoxicity. This question tests the ability to differentiate between the distinct side effect profiles of two common diuretic classes. The keywords loop diuretics, furosemide, and thiazide diuretics, hydrochlorothiazide, and characteristic of loop diuretics, but generally not seen with thiazide diuretics, are critical. Ototoxicity, hearing loss or tinnitus, is a unique and potentially serious adverse effect specifically associated with loop diuretics, especially with rapid intravenous administration or high doses. While both classes can cause hypokalemia, hyperglycemia, and hyperuricemia, ototoxicity is a distinguishing characteristic of loop diuretics. For instance, a patient receiving a high-dose furosemide infusion should be monitored for hearing changes, a risk not typically present with hydrochlorothiazide. Remember that ototoxicity is a key differentiator for loop diuretics. Question 23. A patient requests a copy of their prescription history from the pharmacy. According to Canadian privacy legislation, e.g., PEBC or provincial equivalents, what is the pharmacist's obligation? A. Provide the requested information immediately without verification. B. Refuse to provide the information, citing patient confidentiality. C. Verify the patient's identity before releasing the information. D. Provide the information only if the patient has a valid power of attorney. Answer: C. Verify the patient's identity before releasing the information. This question addresses a fundamental aspect of patient privacy and information access in pharmacy practice, governed by legislation like PEBC, Personal Information Protection and Electronic Documents Act, and provincial acts. The keyword patient requests a copy of their prescription history means the patient is seeking their own personal health information. Pharmacists are legally and ethically obligated to release this information to the patient upon request, but only after properly verifying the patient's identity to ensure the information is given to the correct individual, protecting against unauthorized disclosure. For example, Asking for photo identification or using other secure verification methods ensures privacy is maintained. Always prioritize identity verification when releasing personal health information. Question 24. A healthy adult patient born in 1995 requests a tetanus booster shot. According to typical Canadian immunization guidelines, how frequently is a tetanus diphtheria, TD, booster recommended for adults? A. Every 2 years. B. Every 5 years. C. Every 10 years. D. Only once in adulthood. Answer: C. Every 10 years. This question assesses knowledge of routine adult immunization schedules, a public health and patient counseling responsibility for pharmacists. The keywords healthy adult, tetanus booster shot, and how frequently are key. According to general Canadian immunization guidelines, healthy adults should receive a tetanus diphtheria, TD, booster every 10 years, or earlier if there is a severe or contaminated wound and the last dose was more than 5 years ago. For example, if an adult last received a TD booster 8 years ago, they would not typically be due for another until 2 more years pass, unless a specific wound necessitated it. Remembering the 10-year interval for TD boosters is crucial for appropriate patient counseling. Question 25. During medication reconciliation for a newly admitted hospital patient, a pharmacist identifies discrepancies between the patient's home medication list and the physician's admission orders. What is the most appropriate next step for the pharmacist? A. Dispense the medications as per the admission orders, assuming the physician made necessary adjustments. B. Document the discrepancies in the patient's chart and notify the nursing staff. C. Contact the admitting physician to clarify the discrepancies and reconcile the medication list. D. Instruct the patient to continue taking their home medications in addition to the new orders. Answer: C. Contact the admitting physician to clarify the discrepancies and reconcile the medication list. This question focuses on a core quality assurance and patient safety activity, medication reconciliation. The keywords medication reconciliation, discrepancies, and most appropriate next step highlight the need for immediate corrective action. Identifying discrepancies means there's a potential for medication errors, omissions, duplications, incorrect doses. The pharmacist's primary role is to resolve these discrepancies by directly communicating with the prescriber. For example, if a patient's home medication list includes a statin, but it's missing from the admission orders, the pharmacist must contact the physician to determine if it was intentionally held or accidentally omitted. Promptly clarifying and reconciling the medication list with the physician ensures the patient receives the correct medications safely.